Let's move on to thrombectomy. A thrombus means a blood clot, right? And embolectomy is a removal of the embolus, which is a moving blood clot or a blood clot in a stream, okay? So let's see what are the types of thrombectomy that we are going to encounter. So we have the arterial thrombectomy and the venous thrombectomy. In the arterial side, when the thrombectomy is being done for the first vessel, it is a initial. We also have something called like mechanical thrombectomy. You will have to know whether this thrombectomy is done as a primary procedure or is it being done in addition to another extensive procedure. Next is thrombolysis. In order to remove the thrombus, they can also do or give some infusions like a drug infusions, and then they are going to remove the blood clot, which is called a thrombolytic therapy. The thrombolytic therapy can be done again for the artery or for the vein as well. So depending on that, you can take the code. Here there is something called cessation of thrombolysis. So imagine the patient has underwent the admission of a thrombolytic therapy. You will have to give the initial admission code, in the sense like initial administration of this thrombolytic agent. Second day you have a secondary code, and when they are going to stop it, you can give the cessation code. Next there comes embolectomy, which is nothing but removal of the embolus. Next is endarterectomy, which means a patient has severe atherosclerotic disease. They are going to completely perform the arteriectomy and embolectomy. You should understand, when they have done an endarterectomy of a vessel and a thrombectomy or an embolectomy, this thrombectomy and embolectomy is bundled into the endarterectomy. You will have to report only the endarterectomy. So commonly you find carotid artery stenosis where the patient develops atherosclerotic disease. In that case, they do endarterectomy of the carotid vessels. So you can report the code 35301, whether it is right or left or bilateral.